Tonight for you in Medical Rounds, we are talking about a less invasive surgical advancement when it comes to treating patients who suffered from a certain kind of stroke. The technology allows doctors to remove blood clots from the brain that could not be removed before. This is pretty incredible. Joining us right now is Dr. Inam Kureshi, a neurosurgeon and chief of neurosurgery at Hartford Hospital. Hi, doctor. Thank you very much for joining us tonight.
Yeah, pleasant to be here.
Well, let me ask you first, and I'm not sure, I hope I'm saying it correctly, but can you explain what a hemorrhagic stroke is?
Yeah, sure. Hemorrhagic stroke occurs in the brain where a small blood vessel starts to bleed in the brain, and it causes sudden and rapid pressure on the brain, also damage to the brain, resulting in stroke-like symptoms like paralysis, weakness, headache, and even possibly stroke, coma, or death.
So my understanding is, doctor, you have this new device called the Artemis Neuro Evacuation Device. What is that? How does this work?
Yeah, it's a very small, slender device. It's only about 3 millimeters in diameter, and it allows us to actually go into the brain through a very small incision and remove these deep blood clots that are causing pressure on the brain without causing any damage to surrounding structures, and also giving a patient a chance of good recovery.
What was typically done for patients who had suffered from these kinds of strokes before?
Not a whole lot. Typically, they're admitted to the ICU where they're treated to watch for their blood pressure not getting too high or making sure they don't have any brain swelling. And there wasn't a whole lot we could do for them. Sometimes invasive surgery was too invasive and it would cause more harm than any good. But this new procedure allows us to do an operation where we minimally can invasively go in and take out a blood clot without disrupting any surrounding brain tissue.
You have performed a number of these cases since it was introduced at Hartford Hospital back in November. How have patients been doing?
Yeah, excellent. We've done a handful of cases, and the patients have done very well. Most of them have gone to rehab already, and their length of stay in the hospital has been shorter, and they seem to show some faster recovery as well.
Well, I just want to ask you briefly, doctor, if you could just go over quickly what the symptoms are regarding a stroke, because obviously this is very important for folks at home.
Yeah, absolutely. The symptoms are basically sudden onset of severe headache with nausea or vomiting, sudden facial paralysis, weakness on one side of the body, or sudden dizziness. All those things, if they occur, dial 911.
Okay, very, very important information, doctor. We really appreciate you joining us tonight and sharing this incredible new technology with everybody. It sounds promising, to say the least. You're an actual brain surgeon. That in of itself is very impressive, so thank you very much. If anyone at home would like to learn more about this procedure, it's very easy to find out. Just call the number right here, 1-855-HHC-HERE.